Hi, my name is Glennis Irving. It's May 31st, 2022. I'm doing the skeletal system presentation. Here are my notes just for the little small bones you can't really see on the skeleton. So the skeletal system has many functions. I think the main function would be the structure and support. It's literally the reason why we can stand upright. It also stores minerals and produces blood cells, and it also provides protection in certain areas. So like in the rib cage, it protects the heart, the lungs, and even the spleen in the back. And then in the pelvis, it protects our bladder, and then for women, the uterus, the ovaries, and fallopian tubes. There are different shapes of bones. One is the sutural bones, which are up here on the skull. They kind of like fuse the cranial bones together. And then there's pneumatized bone, which have air pockets in them, like the ethmoid bone. And then we've got the long bone, like the femur, small bones, like the carpals and the wrist. Irregular bone, which is like the vertebrae, and then flat bones like the parietal bone, and then sesamoid bone, which is kind of like a roundish bone like the patella. The skeletal system is separated into two different things, like the axial skeleton and the appendicular skeleton. The axial skeleton is just composed of the head, the rib cage, and then the vertebral column. And then the appendicular skeleton is kind of like our limbs, our pelvis. And so for the axial skeleton, we have the skull here. There's the frontal bone, the parietal bones on the side, the occipital bone in the back, and then on the side here is the temporal bone. Then there's the zygomatic bone, which like kind of forms into what we kind of see if our cheekbone is. Then down here is our mandible with their teeth. Then there's the maxilla, and then the nasal bones. And then on the inside of the eyes here, you have the lacrimal bones, the palatine bones, the ethmoid bone, and then the sphenoid bone. Then also on the side here was like where our ears would be. We have ossicles, which is our inner ear bones. Then going down the vertebrae here, our vertebral column is separated into three different pieces. So the first is the cervical spine, which is 7 of the vertebrae. Then there's the thoracic spine, which has 12, and then the lumbar spine, which has 5. The top two bones in the cervical spine are the atlas and the axis. And then just a little more detail on the vertebral bones. You have the spinous process here, the transverse process on the side, and then kind of like in this little notch on either side of the spinous process are the pedicles. Then coming down is the sacrum, and then the coccyx. Then coming around here, you've got the rib cage. The rib cage has the true ribs, false ribs, and then the floating ribs back here, which are literally just floating here. They're not connected to any like cartilage in the front. Then we have the manubrium, the sternum, and then the xiphoid process. So that's it for the axial skeleton. So for the appendicular skeleton, you have the, starting with the hand, you have the phalanges, and then the metacarpals, and then the carpals, which are the wrist bones. So in the carpals, starting from the thumb side, there's the trapezium, the trapezoid, the capitate, hamate, pisiform, triquetrium, lunate, and then the scaphoid. Then there's the radius, the ulna, and then the olecranon, which would be like our elbow. It's at the end of the radius here. Then the humerus, and then the humerus goes into the glenoid cavity of the scapula. So then we've got the scapula. There's this bone that kind of comes out of the scapula, which is the acromion, and that leads into the clavicle. And then there's like a little protruding bone right here coming out of the scapula as well, which is the cricoid process. Then, starting at the feet, we have the phalanges again, metatarsals this time since we're in the foot, and then the tarsals. Starting with the big toe side, you have the 3 cuneiform bones, and then the cuboid on the side, the navicular, and then the talus. Then on the back here is the calcaneus, which is like our heel bone. Then we have the fibula, and then the tibia, the patellar, or patella, and then the femur. And the femoral head goes into the acetabulum of the pelvis. Then the pelvis bones, the biggest bone here is the ilium. And then you have the pubis here, and then the ischium is down below here. So a couple examples that you can relate the skeletal system to your future career, or for me, my current career too, is I'm a surgical technologist, and so I actually do a lot of orthopedic surgeries with orthopedic surgeons, and depending on what bone is broken, I need to know that, and that kind of determines like the size of certain supplies or implants, maybe like plates and screws and nails. So that's useful. It's useful to know the skeletal system for my job. And then if I was a PA, say I worked with a neurosurgeon as a PA, I would need to understand the different vertebrae due to like which nerves may be coming off each of them, be able to read the MRI to see like where a fracture might be or which vertebrae the fracture is at, and then decide what the best outcome would be for that patient, whether it's surgical or something else. And